is our Airgent machine, and we have it set up to the treatment parameters that we want. We have a fill level of 8, we're at 35% pressure, and we're ready to get started. So we're going to come over here. April has been set up and prepped. And we're going to clean your skin off really, really well with our chlorhexidine solution. Just make sure I got the light right where I want it. Okay, so we're ready to fire. And this is basically a fancy air gun. It sounds exactly like an air gun you are going to hear on a construction site. It's a little disconcerting the first time you have it done, but April, who's now had this done twice before, you're pretty used to this, and you could probably sleep right through it. Right, April? Right. So what I'm doing here is I'm firing it right into the hairline, so you don't really see the little marks that are going to be left. You are left with little red dots that take anywhere from 3 to 5 days to go away. But when they're in the hairline, you really don't see them. It's going to be very difficult for you to appreciate, looking at this with the camera, exactly what's happening. But when we get down a little bit to the cheeks, I'll show you what the little welts look like. This machine fires itself, pumps itself up as we're doing the treatment. So the sound you're hearing there is the collecting of the air back into the chamber. It's basically a pressurized tank that allows us to fire the rockets in under pressure. So April, are you feeling this much at all?
No.
You have to remember that I do mix up the solution with lidocaine, which is local anesthetic. So what I'm doing here is sort of firing the same areas I've already fired into, so you don't really even feel it because you're anesthetized basically. And the nice thing is that usually right away you see a little bit of difference. You'll see that this eyebrow is lifted. That's of course not the process that's going to give you the final result. What we actually seem to do is get a little bit of a muscle contraction here, which will lift your eyebrow, and you're going to see that. Okay, let's come down here in front of the ear now. And of course we're trying very hard to miss any veins, because if we hit veins we can cause bruising. We don't want to do that. Did I ever bruise you?
No, I've never had a bruise.
Perfect. So I'd like to hear. I'm going to fire a few more of these spots.